Good day, everyone. I'm Jurilo Palcolio, Business of Science in Information Technology, Section 2. This is the advocacy about COVID-19 pandemic in relation to globalization. The world is experiencing a major pandemic caused by the coronavirus causing COVID-19. This disease first entered the human population in Hubei province in China. In mid-November 2019, and manifested in Wuhan, the largest metropolitan area of Hubei, when a cluster of patients were admitted to hospital with a severe pneumonia of unknown cause in early December. COVID-19 has impacted the lives of all of us. The virus poses a risk to everyone's health and is proving to be especially dangerous for people with certain types of disabilities and chronic health conditions, as well as older adults. The pandemic has disrupted our lives and changed the way that we go to school, work, socialize, and more. Government and private sectors' responses may also pose additional harm to disabled people if discrimination based on disability results in the denial of healthcare. There is a very real possibility that the spread of COVID-19 will result in a drastic reduction of personal assistance available to provide support to disabled people who rely on their assistance with activities of daily living. The pandemic hasn't been all bad news. COVID-19 spread the rapid mobilization of scientists worldwide and has fostered unprecedented global cooperation to develop a vaccine. The World Health Organization, or we say WHO, with the capital WHO, created the R&D blueprint which has facilitated a coordinated and accelerated response to COVID-19, including an unprecedented program to develop a vaccine, research into potential pharmaceutical treatments, and strengthen channels for information sharing between countries. Artificial intelligence and advanced computing power have facilitated unparalleled rapid development and testing of potential vaccines. PPE shortage also sparked a wave of innovation as companies large and small and entrepreneurs began to create and manufacture face masks and face shields. Due to the coronavirus, more people are working remotely than ever before. Once the pandemic subsides, many companies will explore the long-term potential of working remotely. The fast speed of this pandemic and the unavoidable time needed to discover and develop useful medications. Antivirals and vaccines advocate strongly for the urgency of implemented public health measures of hygiene, respiratory, and environmental, case detection with the proper case management and isolation, coupled with social isolation and population quarantines of a duration which may differ according to the objectives, such as buying time to avoid the collapse of local health system. For the discovery of useful treatments, antivirals and vaccines, and have sufficient capacity in terms of ICU beds, ventilators, and other equipment needed to save lives. Eagerly awaits news of a coronavirus vaccines. International collaboration will be needed for the global manufacturing, distribution, and rollout of an approved vaccine. For COVID-19, we learned early on that there are marked differences in pathogenicity based on age groups, with a pronouncedly higher mortality from the age of 60. It is difficult to understand that no developed country prioritized control measures to be applied to aged people's residences. Many deaths could have been avoided. That's all, sir. Thank you.